Hello everyone, this is Dr. Lori Langdon, board certified pediatrician, mother of 6 and grandmother to 2, with a quick discussion about pacifier use. A lot of parents ask about this before the baby is born, and so it's a good time to think about it as you're preparing for a new baby. We, as pediatricians, have mixed opinions about pacifier use. There is certainly a concern for nipple confusion early on when the baby's learning to latch and when breastfeeding is getting well established. So we would caution on overuse of the pacifier early on when really if the baby is showing you hunger cues, they just need to nurse and they need to be latched onto the breast to stimulate milk production and to get enough calories to catch up from their normal loss of birth weight. So that they can make it back up to their birth weight by the 2-week well visit. So I never want you to think of pacifier use as a replacement for a feeding or a way to postpone a next feeding. That would be a concern. But in real life, is nipple confusion usually a problem with exclusively breastfed infants and pacifier use? No, it's not usually a problem. So I really am okay with it. And remember, I think of it as we all have non-nutritive oral needs. So let's say I like to chew gum. I really don't need any more calories, but I just want to do something, so I chew gum. It's sort of the same thing with infants and a pacifier. If they just have that soothing, suckling motion that helps calm them, a pacifier could be extremely relaxing for them. And trust me, if you have a newborn who is typically fussy for many hours per day, and that's in the normal range, anything you could find that could provide some soothing would be good for the baby and for you. So I hate to tell you, you have to withhold that from the baby. And then on top of that, there is a correlation with lower risk for sudden infant death syndrome in infants who use pacifiers. So we really don't have a problem with a pacifier use. Now, it's extremely important for bottle-fed infants to get rid of the bottle by 1 year of age. For pacifier use, it's not quite so urgent. Now, you should never put anything sweet on the pacifier. Obviously, no babies can get honey under 1 year of age, and no babies need syrup or sugar or honey put on a pacifier. That would be horrendous for a million reasons. The flora in their oropharynx, cavity risk, horrible. It would be terrible for them. Don't ever do that. But I'm only recommending or okay with a normal pacifier used to help soothe the baby so they can sleep better, and maybe you can sleep better occasionally and they can be calmer. If they're upset, it can just help them calm down a little bit on their own with the pacifier use. So our hard stop or deadline for getting rid of a bottle is 12 months, and then for getting rid of the pacifier is 2 years. Now, obviously, if you can get rid of it sooner, that's great. We would never want it to be used so frequently that it interfered with expressive language development. That would be terrible. But just in general, the use of the pacifier is fine if it calms your baby and your baby's still having good weight gain and still latching well at the breast. It is almost never a source of nipple confusion. So I hope this helps you calm down and get a little permission for using pacifiers, especially if it helps. Some babies love them, some don't. And often babies can figure out other self-soothing techniques like sucking on its thumb or its fingers and things like that. And all those things can help to soothe or calm the baby, which is a win-win situation.